Yes, ma'am. Right there in the orange.
Yeah, hip
How do we encourage the public to make changes that can affect lifestyle changes that affect illness? And you know, studies, if you don't know this, have shown that 1/3 of illness is caused by obesity, diet, or smoking, or lack of exercise. That is in the reform bill, and let the congressman address how that is addressed within the bill. Yeah, okay, Dr. Kaufman? I'm sorry?
Yeah. Well, it's very important to encourage healthy lifestyle behaviors and to, in some way, incentivize people to opt to lead a healthy lifestyle. In addition to what's in the healthcare reform bill, as far as enabling that to occur, there's a lot of additional legislation that will look to improve environmental issues that impede people from actually being able to have the healthy choice as the easy choice. So there's a significant amount that will enable, first of all, an improvement in everybody's ability to live healthy, and then certainly an incentive in some way or another for people to actually get back some incentives in the healthcare reform package to do that.
And
I think I want to give each of the panelists a chance to address this. Congressman?
I'm just going to add very briefly that one of the things that the bill does is really tries to encourage preventive care, which is incredibly cost effective, and it does it by basically prohibiting cost sharing, forcing the cost of preventive care on the individual, because we want to incentivize exactly the kind of conduct you're talking about. If we can treat people preventively rather than waiting until they show up in the emergency room, it's enormously better for the person and cost effective for the system.
Ms. Lessing, do you want to address this in terms of the older population?
Yes, in terms of the elderly population, what we think of as prevention is we're sort of past what they ate for 40 years, we're 50 years. We're dealing with things like falls, amputations, hospitalizations, infections, and it's very, very possible to make enormous traction. I've said it already, I think 30 or 40% of the cost of Medicare could be reduced by better managing chronic conditions. But I think it's going to take not only educating the public, which is what you suggested, but I think this directly ties to that comment about how physicians and hospitals get paid. If physicians were paid, for example, for preventing amputations rather than doing amputations, that's preventive care. And we need to go towards a health system payment that teams the patient and the physician and the hospital and other healthcare providers in keeping people healthy. And it's both lifestyle, but it's also a very different model of what it looks like to keep people healthy.
Mr. Flanagan?
The issues of whether or not you can get coverage based on your weight or if you smoke or if you diet are very much true for existing health insurance. I've seen the internal guidelines of insurance companies that literally will have a chart that will have your height and weight, and if you exceed the weight for your height, they won't sell it to you. That's the private market. A lot of what the bill is trying to do is taking the worst practices of the private market, which is a monopoly and therefore doesn't have to respond to consumers, and barring these anti-consumer practices. For smoking in the Senate Finance Bill, if you smoke, you'd pay more. Now, under the existing market, you do that as well. As a matter of fact, you might not get coverage. But one concern is, well, if you price people out because they smoke, then they can't get in order to get the smoking sensation they need in order to stop smoking. So smoking shouldn't be a bar. Weight issues, it's primarily a prevention because, right, well, also weight can be medical. So we don't want to bar people, but focus on wellness and prevention. Diet is obviously economic, so it needs to be addressed broader than just healthcare.
Dr. Chu, you want to say something about the effect this has had at Kaiser?
Sure. I think that in the bill there are numbers of things that talk to, and I think Congressman Schiff alluded to, not having co-payments for preventive types of measures. But also, in the bill, there's at least one version of the bill, there's an incentive for plans to actually, address many of these issues as an enhancement for getting better health for the members, and so that indirectly will actually get to some of the questions that you're asking about.